Welcome to Cardio Flash College, a place to learn cardiology with flash animations. Today we have a chapter titled How to Make Your Own Culotte. To help us with this topic, we once again count with the help of Dr. Pedro de Sousa and Dr. Pedro Gonçalves, interventional cardiologists of the Hospital Santa Cruz at Lisbon, Portugal. Join us. As you already know, the percutaneous treatment of coronary bifurcation lesions can be an absolute challenge for the interventional cardiologist because different clinical and angiographic factors need to be considered during the planification of the procedure. Different therapeutic options exist in the world of coronary interventionism and coronary bifurcations, but today we are going to show you a, nowadays, very popular angioplastic technique with two stents. Today, we will teach you how to make your own culotte. But before starting, we recommend that you take a look at our previous video, General Aspects of Coronary Bifurcations and of the Culotte stenting technique. This way, it will be easier to comprehend some technical and distinctive aspects of the culotte. With this said, let's see how a culotte is made.
Step 1. An angioplasty guide wire is introduced in the main branch and another one into the side branch. We recommend using the first guide wire to navigate through the branch with the most severe or complex lesion, so we have full freedom of movements. The second one shall be introduced carefully, avoiding rotation movements that could include the first guide wire. Step 2. We prepare the lesions with pre-dilation balloons. Sometimes can be necessary the use of cutting balloons or other pre-dilation strategies in cases with calcified plaques. Step 3. A drug-eluting stent is implanted in the most angulated branch. To be practical, we will consider in our case that the most angulated branch is the side branch. Therefore, the diameter of the stent shall adjust to the diameter of the distal segment of the side branch. On the other side, it is not necessary to take the guide wire off the main branch, since this one must stay jailed. This is a common practice in the percutaneous treatment of coronary bifurcations, and it is known as jailed guide wire. The jailed guide wire allows us to, among other things, localize or even access the side branch in case of emergency. Step 4.
A post-dilation of the proximal segment of the stent is made. This is called a POT, which means proximal optimization technique. It tends to be made with two non-compliant balloons and has the objective of adjusting the diameter of the stent to the diameter of the proximal segment of the vessel. This is necessary because, among other things, we ease the rewiring inside the stent and not outside.
Step 5. Rewiring. Different strategies exist in this case, but we recommend keeping the first two guide wires in their respective vessels and introduce a third guide wire through the stent. The idea is that the guide wire went out through the more distal struts and arrived to the distal segment of the main branch. Many times it can be necessary to use a low-profile balloon to open a window in the first stent. This will allow us two things. The first is to confirm that the new guide wire does not possess a course outside the stent, and the second is to ease the progress of the second stent through the first one. Step 6. A new drug-eluting stent is implanted. This new stent will navigate inside the first one and will implant in the main branch, overlapping as less metal as possible and adjusting its diameter according to distal segment. Before implanting the new stent, it is advisable to remove the guide wire of the side branch in order not to jail it between two metal layers. Step 7. The caliver is adjusted to the proximal portion of the second stent with a new pot. Step 8. Rewiring again. For this, a second guide wire is introduced inside the two stents and it is made to pass through the struts that jail the ostium of the side branch. Sometimes it can be necessary to open a window inside the stent with a low-profile balloon with the objective of relieving the next step. Step 9.
A simultaneous post-dilation of both stents is made with the kissing balloon technique. For that, we usually use two non-compliant balloons the way we showed then. First, dilation of balloon located in the side branch. Second, dilation of the balloon located in the main branch. And third, simultaneous deflation of both balloons with the intention of avoiding neocarina displacements.
Step 10.
Finally, some authors recommend to make one last pot with the intention of correcting the possible deformation of the proximal segment of the stents after the kissing.
To summarize, this is how a culotte is made. And this is the definitive aspect from different perspectives. Well, our time is over. It has been everything for today in Cardio Flash College. We hope you like our video. If so, subscribe the channel and leave a like. We'll see you in the next class. And remember, don't come late. Bye.